Hi, I'm Paul Mullan, a pediatric emergency medicine physician and quality improvement expert, and the founder of StatDebrief, a technology, an app, and software platform for healthcare teams to use to rapidly debrief after patient care and improve outcomes faster. Over the past 15 years, I've enjoyed helping over 60 healthcare teams across the globe to start their own healthcare debriefing programs. StatDebrief has been designated as a Changemaker Organization by the National Academy of Medicine and is sponsoring today's webinar as part of the second annual Healthcare Worker Wellbeing Day. In this webinar, I am joined by two close colleagues, Adam Cheng and Jennifer Arnold, who have also worked extensively in the field of debriefing. In this video, we will be discussing some of the key components of how clinical debriefing, that is, quick, structured team conversations during patient care, can help to improve both healthcare worker well-being and patient outcomes. This is not psychological first aid debriefing, and this is not critical incident stress debriefing. This is real-time, practical debriefing for teams to rapidly improve healthcare. Adam Cheng will be moderating a panel discussion with Jen and I as we explore critical topics in more detail. You'll see how the benefits of debriefing play out in healthcare. We will introduce a field-tested implementation blueprint checklist of how you need to design your own programs. And you'll understand how StatDebrief's app and software technology can support frontline teams and leadership with actionable insights to help solve problems in healthcare faster. Because if your hospital is struggling to establish a strong safety culture, or your improvement efforts are moving too slowly without real results, or you are struggling with staff engagement and with sustaining wellness in your teams, then this session is for you. Together, let's learn about how to debrief smarter and improve care faster. Let me tell you briefly about my own debriefing journey. So it really started back in 2007 when I was working after my pediatric residency in Gaborone, Botswana, where I was covering the wards there with some other physicians. That site had the second highest HIV rate in the world, and almost every day on shift, we would have at least one child who died, typically of PCP pneumonia or gastroenteritis. And culturally there, after major events, the team would gather and they would go around and each and every member would speak up. And we would talk about what we could do better next time or what individuals on the team needed at that moment. And this really became the culture for me working on the wards in addition to giving care. And so when I left Botswana after a couple of years of working there and moved to Texas Children's Hospital, in my first year there, we had one overnight shift where we had, unfortunately, two back-to-back cardiac arrests of infants who came in. And we did debrief after the first cardiac arrest, which wasn't something that we did after all cardiac arrests. But what we noticed was that after that first one, we had much better improvement on that second one in terms of our overall team performance. We transitioned between cardiac cycles faster. We had less team leader confusion. And so after that, I really wanted to know what is the literature showing on this. And the American Heart Association at that time had just come up with their guidelines recommending debriefing after critical events. But unfortunately, if you look at this highlighted part, it said that there's really needs to be research on how best to teach and implement post-event debriefing. And so I used some of those same models of the plus delta framework that I had in Botswana, and we ended up publishing the first clinical event debriefing program for hot debriefings in civilian medicine. And since then, Adam, Jen, and I have implemented a lot of different programs, and we've published widely in this area, and we're excited to sort of share a lot of our learnings with you today. So, Adam, if we can just take a moment to reflect and maybe share and see where everyone is.
Yeah, thanks, Paul. And so at this point in time, we'd love to just hear from each of you on if you can just throw into the chat box the answer to this question. What are you currently doing with respect to your debriefing activities? For one, one is essentially you're not debriefing at all, or it's happening very rarely. Two, debriefings and simulations primarily. Number three, clinical debriefings without a tool. Four, clinical debriefs with a tool. And then five, with a tool, but also tracking outcomes and collecting data and using that to inform changes within your hospital. So I'll take a look at this. So it looks like we have quite a few fours here. So quite a few people doing clinical debriefings. Caitlin and Aaron are mostly doing sim debriefings, and then Kelly's sort of doing all sorts of things depending really where in the hospital. So mixed bag, it sounds like. Oh, yeah, Debbie and Shelley are doing debriefings in a variety of different contexts, as well as Lena. Okay, great. All right, great.
Great. Awesome. Thanks, Adam. Yeah. So a true diversity. We probably have a little bit of a selection bias, which is great because we've got a lot of people here who are champions in their own right. And we know that clinical debriefing is recommended not only by the American Heart, as I mentioned, but many, many different organizations have come on board over the last decade and sort of realized the value of it. And when we look at other high stakes industries and high reliability industries like the aviation industry, we see that their safety and quality and their harm events has gone way down over time with debriefing. Unfortunately, in medicine, we don't debrief very often, and our harm has stayed the same or potentially even increased. And so, addressing this challenge with debriefing is one of our main goals for the three of us, and it sounds like for many of you as well. So our next part of this webinar is going to get into a panel where we go through some really key questions, and Adam's going to lead this panel for us next.
Yeah, no, great. Thanks so much, Paul. Yeah, so I guess as we transition to the panel, we'll be sort of pulling on the experiences that Paul and Jen have had over the past 1 to 2 decades in building and sustaining their debriefing programs. So I'm curious to hear from Paul first, just in terms of the benefits. What metrics do you suggest that we use to evaluate the effectiveness of a debriefing program, both in terms of like a healthcare worker well-being, but also with respect to clinical outcomes?
Yeah, thanks, Adam. I mean, healthcare worker well-being and clinical outcomes, I see them very closely tied. I went through a lot of those metrics, and I know it was sort of just a flood, but we'll be sharing this information and the references with all of you. But I really think of the data and the metrics that we can collect in terms of different time points. I sort of think of it as like, what can you collect on this shift or today? What can you collect from a monthly level? And then what's that longer term year level? And you're really learning from the data. Really, the purpose of all data is to learn from it. And when I think about it like the today data, it's really asking people either right after the debriefing or shortly after, maybe the next day, getting that informal feedback from your frontline on, hey, how was that debriefing? Was there any benefit? If there wasn't, why not? Or if they weren't able to debrief, maybe for a specific trigger that you're looking to debrief on, how come the team wasn't able to find that time? Or maybe it was another barrier. So really that's sort of the today feedback, but then you can also look at whatever triggers you've decided upon. You can look at it from a monthly standpoint, and maybe there were 20 intubations and maybe you debriefed 10 of them. Again, sort of like talking to your team, talking to the front line, both the people who did debrief and maybe who didn't, and really trying to understand what benefit they're seeing from it. And then your hospital might already collect some of that yearly data, whether it's individual performance on certain events, or maybe it's a safety culture survey, right? A lot of hospitals use the AHRQ SOP survey. Some of them might use the safety attitude question survey. Whatever you're using in your hospital, I think it's best to sort of use what you have. That's really healthcare worker well-being. I think from a clinical outcome standpoint, again, it really depends on what your big clinical metric there is. Early on, the debriefing literature focused on cardiac arrest more, but we're really seeing a huge diversity of different clinical events where people are really using debriefings to learn as quickly as they can how they can address those urgent needs.
So, Paul, I'm just curious, with respect to clinical outcomes, I think one of the biggest challenges is collecting clinical data. Right? What I've learned from you is that in the debriefing programs that you've implemented, that you adjust the goals of your debriefing programs month to month, or maybe over several months to suit the needs of what's happening on the ward, right? And so can you talk a little bit about how you might adjust what clinical outcomes that you're collecting, how you determine when you're going to switch, what types of clinical outcomes that you're collecting, and what that entails?
Yeah, that's great, Adam. I mean, I honestly look for where is the fire burning the brightest. I think about I was doing a lot more procedural debriefing programs, looking at seizures and intubations. But in my current ER, around 2015, 2017, we started seeing a huge increase in behavioral emergencies. We had over a 300% increase in the number of kids presenting with aggression or harming themselves. And a lot of times when they were presenting, they were also harming our staff. And so it was a real eye opener for us. And we started debriefing that right away. And again, it took about a year or two for us to sort of learn all of the different processes that we need to fix. But within 2 years, we had an 82% decrease in the amount of time that our patients were spending in physical restraints. And so, yeah, just an example of you really need to see where is the crisis, and you really have to react. You almost can't plan it. Like I think about COVID too. COVID happened, and we certainly weren't planning on a pandemic, but within a month, we shifted to doing COVID-19 debriefings really at the end of the shift instead of after each event, because that was when people felt like they had the bandwidth to talk and they weren't in all their PPE. So I think it's hard to determine when, but I think the what becomes obvious.
Right. Yeah, no, those are some great examples. I mean, I think the message is just to be able to be adaptable and dynamic and adapt the focus of your clinical debriefing programs to the current needs within your units.
Yeah.
Before we go on to the next topic, I'm just curious to hear from Jen what your perspectives have been in terms of data collection within the neonatal intensive care unit.
Yeah, I would say the main thing to add on to what Paul said is it's really great if you can find someone who's already tracking data related to the content of your clinical event debriefing program, so that in you can track with that, whether it's a control chart, patient safety data, you make sure that you're already using data that's already being collected. And that can be an easy win to help you see the value of your program, see what changes occur after starting your program, and then helps you to get more resources to help gather more data as you expand your program.
Yeah, most hospitals already have databases already. And so if you can just tap into those pre-existing resources, you're not having to reinvent the wheel to integrate them into the clinical program. So yeah, love it. Great advice, Jen. Thanks. So Jen, I'm going to come to you next and chat a little bit about psych safety. And so curious to hear your advice on how debriefing sessions can be structured to provide, a comfortable, safe space for healthcare workers to feel comfortable in speaking up, discuss their experiences, and even reflect on when things don't go well.
Yeah, no, that's a really good question, Adam. And it's a tough one, right? Because how many of us, I can raise my hand, have been in a debriefing or in a situation just where you didn't feel safe to speak up and share your perspective, typically due to hierarchical issues or maybe just the situation at hand or, certain personalities. So I think it's really important to remember that just because we say this is a safe space doesn't necessarily mean it's a safe space for everybody. And so the goal, though, is to create as psychologically safest space we can, so that we can have those conversations and really learn from what happened. And so what is psychological safety? It's really just the concept that we've created a space where we can speak honestly and we can take risks without fear of negative social or professional implications. And so there are some key features of a psychologically safe space. Obviously, we should feel free to share our perspectives openly. Feel free to disagree in a safe space. We often have a shared sense of belonging when we have psychological safety, which allows us to remain engaged. It's also a space where there's fostering of curiosity and even can inspire innovation, but most importantly, allow us to speak freely, make mistakes, and talk about mistakes so that we can learn from them. And so some of the keys to trying to create or having a successful space that invites everyone to feel comfortable, I think, are number one, really a clear pre-brief. Why are we here? What are the ground rules? So that everyone is on the same footing at the start of that conversation. I think the other thing is to also define, what confidentiality looks like in your debriefings. And for us, we always sort of say, this is the space where we want to share outside of this debriefing, the lessons learned, the opportunities to improve our systems and our processes, but not the specific performance of individuals. So we try to maintain that confidentiality so that hopefully individuals feel free to speak up. And again, talking about your goals is really key. The other thing that we use, which we take from the simulation community, is that sort of basic assumption that we know that everyone that is here comes to work every day wanting to do a good job and is already, caring, well-trained, and competent. And that sort of sets a level playing field, hopefully, so that we all recognize and respect each other so that we can have those conversations. And then last, a very practical thing to think about when you're creating that safe space is to think about what is the environment around you, who is in the room, and who's facilitating that debrief. And so if possible, try to have a lead or facilitator who not only has training and expertise in debriefing, but also who may not be the team leader, right? So that we can minimize that hierarchy, flatten the sort of the hierarchy so that we can all feel comfortable to speak up. So again, as Adam, you were mentioning before when we've talked previously, someone like a chaplain, maybe your nurse manager, think outside the box about who could be leading your debriefs.
Yeah, I think that's a great point, Jen. I mean, traditionally, it's very easy to sort of gravitate towards the team leader, the physician, so to speak. But if that person is sitting in the chair of the facilitator of the debriefing, inherently, it just makes it really hard for other people to speak up and offer constructive criticism about things that he or she may have done or said during the event. And so, I would agree with you. I'd love to see someone who is perhaps an observer, someone who is in the room, but not necessarily intimately involved in the management of care to help facilitate these conversations. And of course, we'll speak a bit about training later on, but training is key, right? And so you can go ahead and you can set expectations at the beginning, but if they're not trained on how to facilitate an effective conversation and build and maintain a psychologically safe environment, it's going to be a struggle. Yeah. All right. So Paul, we've talked about the importance of psychological safety. I'm just curious to hear from you if you can maybe share your blueprint that you would recommend for programs that are thinking about either starting a clinical debriefing program or perhaps looking to build on what they've already created.
Yeah, thanks, Adam. This has really been a personal evolution for myself. When I look back to what I pulled creating that original debriefing guide back in Texas, there was an article that adapted from the military what they were using and really used some organizational psychology best tips. And there was 12 tips, and they were really critical. And then once that program was done, you, myself, and Dave Kessler came up with this guide that we'd be happy to share with anybody if you just request through email. And this really had 25 tips, really expounding on what we learned. And then, in the ensuing years since then, I've coached over 60 teams for 10 hours or more on getting their programs up and going. You can see the map here of the U.S. as well as people from a lot of different countries across the globe, and I've learned a lot in this process. And while those original tips are still all very valid, we've really had to expand this blueprint into really 3 different stages of what do you need to really launch. And right now it's at 50 questions. And again, this goes through sort of what you would expect of like, who's going to be at the debriefing, who's leading it, where are you going to debrief, when are you going to actually start it, when are you going to finish it, what's the expected timeline, why are you doing it? We talked about that earlier, of like what's so urgent in your environment, and then how do you get people on board, what do you do with that debriefing information, how do you design your tool. And the more of these questions that you consider up front, we've really only come up with these questions based on our own experiences, missteps, and mistakes. And so really wanting you to learn from that. And again, I can send this to anybody. If you shoot me an email at info@StatDebrief, I can get you this initial blueprint. And then there's another checklist of even deeper questions that goes into sustainability issues. Because that's definitely a big thing with programs, is that oftentimes they can get off the ground, but struggle to stay going. And then really there's that deeper visionary debriefing checklist that gets into scaling it and disseminating it and really future-proofing your programs. So a lot to consider, but the basics are still true. But we're really excited and sort of enjoying learning how to get through and overcome all of the struggles to getting these programs off the ground.
That's great, Paul. I mean, I love this idea because I think what it does is it just lays out all the important things to consider when building a clinical debriefing program. I kind of view it as a vehicle for change, right? And in order to be able to maximize the impact of this strategy, we have to be thoughtful about, the who, what, when, where, why, and how that you've outlined in all these blueprints. So thanks for sharing that.
Yeah, absolutely. I mean, it's really implementation science. We're adapting so much of what we learned from other industries You think about, project managers like my sister-in-law, she works for cybersecurity. I mean, she's considering a lot of these same questions anytime she's implementing a project. And I think, in healthcare, we need to take more of that, business-minded approach because I think it just helps us be more successful, more consistently, rather than having projects that get that strong start, but then just sort of, peter out.
Right. All right. Great stuff. So we're going to switch gears a bit and talk a little bit about training. As we all know, debriefing is more of an art than a science. And in order to be able to master art, it takes practice, but also it takes some training. And so, Jen, what are your tips on training? And specifically, how can organizations ensure that their facilitators of these debriefings are adequately trained in debriefing techniques, but also in giving sort of peer-to-peer feedback?
Yeah, no, I think that's so critical. As you mentioned earlier, Adam, the concept of training your facilitators. I can tell you when I first started getting involved in clinical event debriefing way back in the day, we were doing simulation debriefing, and one of my simulationists, who was an educator, was in a clinical event debrief led by someone who wasn't trained, and she said it was just a heart-wrenching experience. And she said the whole time I was in that debriefing, I kept saying, oh my goodness, I wish Jen was here and we need to train this guy. You know what I mean? The person who was leading the debrief really didn't understand how to create a psychologically safe environment and really how to facilitate and ask questions that really allowed for an effective and safe debriefing. And so that's, just to me, just begs to the value of why, training is so important. And in particular, if you think about the different options you have, think about locally. If you have a sim center in your hospital that offers training for simulation education, in training the instructors, they have a debriefing training program. And so you could start there because many of the concepts, as we've been talking about, and best practice for clinical event debriefing have come from the simulation best practices. And then if that's not the case, there are also, programs all over that do debriefing training specifically for simulation and for clinical event debriefing. We have the Debriefing Academy at the debriefingacademy.com, and there's private courses specifically on clinical event debriefing, and then also general courses on debriefing that gives you that sort of how to have the conversation. Because really what we're talking about here, as opposed to the, what Paul was talking about early in terms of creating a program, we're talking about how do you have these conversations? How do you facilitate these conversations? And then, again, you can look regionally for other hospitals that might be doing this to look for mentorship guidance. And then, as I talked about more nationally and globally, the Debriefing Academy also offers an asynchronous masterclass on how to do clinical event debriefing. So lots of resources that are available to you, but not many places out, sort of nationally and internationally that are doing specifically clinical event debriefing other than the Debriefing Academy. So I definitely welcome folks to, ask questions about how best to debrief. Anybody in this panel can share their experiences on how to train each other and to develop those programs. I'll just end by saying that when we started clinical event debriefings in our programs, really one of our very first steps was to always figure out how are we going to train folks on how to have these conversations, how to debrief effectively before we rolled it out.
Yeah, I think that's critical, really. I mean, one of the hiccups that newer programs run into is they run into these programs, they're enthusiastic, they want to start these clinical event debriefing programs, but then they fail to train their facilitators. And if they even have one or two negative experiences or negative debriefings, that can really be a huge barrier to, the propagation and success of that program. And so planning out your training strategy and your faculty development strategy early is really key. And many programs will do that in-house if they have the experience. Otherwise, as Jen mentioned, we do offer programs, either virtual courses through the Master Debriefer course in the Debriefing Academy, and as Paul put in the Academy archive, which is basically online learning at your own pace via subscription, where we have both three debriefing courses, actually, how to debrief, basic and advanced, but then also a clinical debriefer course that Paul runs. So, all right. So let's move on. So we'll talk a little bit about barriers. So we're curious to hear from you. For those of you who are either running clinical debriefing programs or thinking of starting, if you could just share with us in the chat what your main barriers have been. And then from that, we'll transition to Paul, who's going to share some of the barriers that he's encountered and how he's overcome those. So barriers, love to see your barriers in the chat box, please. Yes.
Getting other people together. That's a common one. Yes. I see real time or near time initiation of debriefing. So the sort of the when to do it, how to do that. Again, time. I see time being a common factor during the shift for people to step away from care to participate.
Yeah.
I'm also seeing the concern related to training for facilitators, a lot of individuals wanting to but don't feel comfortable or not even knowing who's going to lead it, identification of that person.
Yeah.
Lack of support and staffing issues.
Yeah, those are some great points there. I mean, time is always a critical issue. Just getting people together, there's always competing priorities in the clinical environment. That's not something we can get rid of, but how do you actually get people to sit down and chat? And then, Jamie's point about consistency, you can't underestimate how difficult it can be to actually debrief in the clinical environment. Emotions are high. It's a real patient. Things may not have gone so well, and these conversations can be very challenging to facilitate well. And so training is key. All right, Paul, over to you. What are some of the barriers that you've experienced and thoughts on how to overcome them?
Yeah, thanks, Adam. I mean, I think our attendees today definitely nailed the big ones. I think time is certainly the number one. I think if we did a word cloud, it's sort of always in the center. And I know Naminder Sandhu and you did a study about a decade ago, and I think some of those same themes that we're seeing here today are still present then. And your number one barrier in that one was time, cited by 91% of the people who responded, the healthcare workers. And we can talk to that briefly. I think I always think of time as an ER doc as I'm busy the whole shift, the whole 8 hours. I'm sort of pumping through as many patients as I can and making sure everybody gets safe, effective care. But if there's ever anything that comes up, you've got some patient who's not happy with something, or there's a procedure that has to happen, all of a sudden you just expand and you make time. And I've sort of thought of debriefing as that regard too. Typically I might be debriefing once a shift, so for 5 or 10 minutes out of my 500 minutes, and I always feel like that time's just worthwhile. But how do you find that time? I think you find it just by sort of iteratively trialing how to find the time. All of the barriers, whether it's time or, as people mentioned, consistent training, or maybe support from your superiors, or finding a good spot to debrief. The only way you're going to figure out how to get over those barriers, because you really cannot get rid of them, but really is to sort of hit the barrier and then figure out, how did I climb over the barrier that time? And you'll start to realize in your environments, here's how we can get over this barrier pretty consistently. And maybe that's a shorter debrief. Maybe someone mentioned the gathering. I have found gathering has been a huge issue with debriefing, where we might only debrief for 5 minutes, but it takes us 7 minutes to gather everybody. And if you don't figure out a way to effectively gather, you're sort of stuck in the mud, because then people start leaving. So all of these are important, and I'm not minimizing any of them, but I do think you just need to hit the barriers and then learn quickly and get that feedback, as I mentioned, from your teams on what barriers they're hitting. Because as the program champion, you're more likely to, run faster and jump higher to get over the barriers than anybody else. But really understanding from other people who might not be running as fast or putting as much effort into getting over the barriers, how can you lower those barriers to make them as feasible as possible?
Yeah, some great tips there, Paul. I love those tips. The one thing I would add is I think a lot of it has to do with a mindset shift as well. And so people think of debriefing as, they may think of debriefing as a particularly painful activity.
Right.
Or maybe it's just sort of lovey-dovey conversations that never actually leads to change. Hence the importance of being able to, number one, do debriefing well when you implement your program. Number two, share your successes and broadcast and disseminate the lessons learned, so that people can actually start to view debriefing as a agent for change within your institution and your unit, right? They have to have positive experiences. They have to see that these debriefings are actually leading to substantial change that's making a difference. And if you're able to prove that, then I think you'll start to see people come to these debriefings or even ask about when the debriefing is going to be.
Absolutely. Yeah. I think of that as like the two W's of they need to be both willing, but they need to find it being worthwhile as well. Once they see that value, which again takes time, you might not necessarily see big, huge value after even one debriefing. But it's really that consistent building of psych safety, as Jen mentioned, and sort of the chipping away out of it. Like we think about James Clear and the Atomic Habits book. Your goal is to really just get 1% better every week of work. And before you know it, you're 50, 100% better over the course of a year. And really, that's how we see that incremental change in other high reliability industries. It's not a light bulb turning on where you go from unsafe to safe. It's really just about getting safer every day.
All right.
All right. Well, we're going to take this next part of the program. And again, people, if anybody wants to throw in some questions that they have, we do have time planned at the end if there are some things that are coming up that we're not addressing today so far. So we do have time and we're here for you. So talking about two different debriefing tool options, when we think about traditionally starting on paper, I love starting on paper because it's so quick to adapt. You can pilot it. You can, that night you can make some changes and you can have a new form the next day. And, this form itself, the original one, went through 12, 15 iterations before I released it more widely. We started with a small group of users and then adapted it over time. And, really to Jen's point, we start with a briefing going over scripted, psychologically safe, enforcing guidelines, collect some basic demographics of the patient and the group, and then we get into the debriefing. And then that form gets turned in. And if anybody needs a copy of this, I can certainly just email me and I can get you a copy so that you could adapt it as well and have fun with that. And I think there's a huge advantage to paper. But again, sort of training those 60 teams over the last 50 years and coaching them and getting their programs going. This is not a true graph of anyone's data, but this is really, I think, a great visual of on the left here, people are starting their programs like sort of excited. They're hiking up the mountain. Everyone's got good energy. Everyone smells pretty good. And then, you get a great initial burst of debriefing activity, and that can last for several months just through willpower alone. But if you don't show that worth of your program and value, again, that debriefing activity starts to get harder to do, and people are less willing to do it when the champions aren't there, and you've got people sort of struggling to hike up the mountain later on. And so, this whole program of sustainability, got me thinking. And so last year I ended up doing interviews with 20 different champions and programs who had published debriefing studies. So people who had, described their programs and got it out there. And there were a lot of sort of key areas where I asked questions, and I learned a lot about it. And there were a lot of similarities to the programs that I had started. But when I talked to them about the paper-based format, most of them said it takes 5 to 15 minutes, which is feasible again in many environments, but maybe not every case. Documentation was sometimes challenging, incomplete, hard to read. Even people who use Google Forms, they said it was just hard to type as fast and keep up with it. And then afterwards, those paper forms, I've typed in hundreds of those forms myself manually into Excel or REDCap databases, and that can get a little tedious. Leadership being aware of the debriefing can be delayed by days to sometimes weeks before they're able to address it. The leadership response can sometimes be very inconsistent, or sometimes none was the feedback from many of these people. The frontline training can be variable. Sometimes you get your whole unit trained quickly and you feel good about it, but then you've got turnover, you've got locums travelers, you've got new residents who are coming in, and you're not able to sort of keep up with keeping people trained, as Adam and Jen mentioned, how important that is. And then analysis of your debriefings. Sometimes it just happens once at the end of a program, or very inconsistently, or sometimes never, and you're just trying to keep up with it. And the actual program itself takes several months to a year. And so, thinking through all this, after all these interviews, I sort of realized there's two big problems with clinical debriefing. Is that as clinicians, we still lack a very easy way to debrief so that we can do it consistently. And as clinician leaders of individual units like Jen's NICU or our ER, the leaders still lack time and expertise to start and, more importantly, sustain these programs. And so in the last year, I've formed a technology company called StatDebrief. And our goal is really to empower hospital teams with a technology for debriefing that helps to improve outcomes in healthcare. And really, that's our mission. And I can show you some screenshots of what we developed so far as we attempt to get this into healthcare. But if you're a frontline clinician, you really start on the left-hand side there. And let's say you complete patient care for an event. It looks like this is a pretty sick person here, but it could really be for any event. And you'd securely log into a mobile app on the smartphone device that you're probably carrying with you on shift anyway. And the app will guide you through basic questions, and it's going to audio record the entire team debriefing. And so once you do that, it uploads to the cloud, and then AI takes over and it gets an alert to your local unit leader. And they get alerted that a stat debrief has occurred. They're able to log into the same cloud-based software. They can review the entire debriefing summary, which, if it's a couple-minute discussion or a 5-minute discussion, it summarizes the major points so that they can do that efficiently. And then they've got task items so that they can start to resolve those action items. And then the team hears back from them in real time that some of their issues that they raised were getting addressed. And not every issue might be able to be fixed right away, but it keeps that accountability log. And when we look at this compared to what the champions were talking about in their interviews, we can get that debriefing duration down to just a couple minutes where we're digitally capturing everything. All the post-debrief handling is automatic. Leaders are instantly aware, and then they automatically notify their teams about what they're doing it. We standardize the onboarding onto this and also refresher training. And then you can analyze all your debriefings on a scheduled basis or on demand. And really, we think this will help people set up programs in weeks rather than months to a year. And so we're very excited about this. Still in the early days, but we've got our prototype. And if people are interested in learning more or booking a demo, you can go to our website and we can get you engaged in that process. Some very exciting news just announcing for the first time today is that we just got approved last week by Agency for Healthcare Research and Quality. They have what's called a patient safety organization list. It's about 100 different patient safety organizations throughout the country. And this allows us to learn collaboratively from all of the different institutions that will be sending us debriefs. And this would be protected patient safety work product so that we can all learn together and all advance our debriefing processes together. So just for all the participants here, I know you haven't gotten the full demo, but just sort of thinking through a product like this, I want to ask you, how would you think that StatDebrief could benefit your clinical setting? If you want to just add anything about what you think might be the main benefit or problem. And thanks, Jennifer. Yeah, the PSO, it just got announced a couple of days ago, so we're not even able to keep up with the website, but the statdebrief.com website will get you there. But the PSO, again, it's so fresh. We just wanted to announce it here. There is, Jen Arnold just shared the PSO website on AHRQ. That is live, so you can see all the information there. But again, thanks, Jen, Adam. But yeah, if people can just sort of think through, how do you think this would benefit your environment? I know we've got people from all different types of settings. We can just take a moment.
Well, while people are thinking, Paul, just from the chat, Jamie just pointed out that, before you started talking about StatDebrief, how there's a challenge, right, with tracking of quality improvements, along with leadership buy-in. So again, I think that there's some of the features of this that could really help with that from a sustainability perspective.
For sure.
And there was a really good question that I thought I would ask you from Kelly, which is, with the app recording, are participants concerned with psych safety if people not in the room are able to see what they said?
Yeah, that's a great question. I mean, essentially, we are that's a big leap, and so people would get the whole transcript. And the way I think of this is psychological safety, like you had mentioned, Jen, is not built overnight. And I think as I've seen these programs, the several that I've done, where we look at hundreds of debriefings, what you notice over time is that people generally start with safer topics. So they're talking about the equipment that's not working, or maybe radiology didn't show up on time, and maybe they're not in the debriefing. And then as people get more used to and more comfortable with each other, realizing that there aren't penalties for speaking up, realizing that things are getting solved in their environment, then they start getting into some more of the more sensitive topics. And that's just a process that takes time. Here in Norfolk, we've got a lot of military people working here. And when I talk to them about their debriefing process, they also mention how when they first started going versus as they started going years later, people just get more comfortable sharing more. People aren't forced to share, but I think what we're hoping to see is that when people get that added level of detail, with actually recording it and summarizing it, and they see problems get solved faster and easier, that they'll feel more willing to speak up. But it's definitely a faith leap. It's a great question.
Similar to that, there's also a question from Jamie about the risk from a medical legal perspective, if there's any specific.
Absolutely. That is a great question. So part of this would be that this would be what's called patient safety work product, or PSWP. And so almost every hospital, certainly in the US, I'm not as familiar with Canada, but of the 6,000 hospitals, they almost all have what are called patient safety evaluation systems, PSES. And within those patient safety evaluation systems, there are methods like morbidity, mortality, incident error reporting systems, and StatDebrief would fall underneath that. And so that work would be protected from a medical legal standpoint. It wouldn't protect, it doesn't erase history. If you give somebody a tenfold overdose of morphine for a fracture, that's still going to be captured in the electronic medical record. But it's really that problem solving that we want people to still be able to feel and speak openly about. And organizations really culturally have to get on board with, we're not going to penalize people for speaking up and saying, the morphine vial was purple instead of red, and the lights were too low, and I couldn't see, and I should have turned on more lights. We want people to speak up and feel safe to do so. And that psychological safety is going to be built over time in the same way that the incident error reporting systems are in healthcare right now. When we look at those incident error reporting systems, we see that only half of people in healthcare report even one incident per year. And so that's another problem that we're just really trying to solve, is why aren't people reporting? We know that people tend to debrief, if not formally with a tool or an app, that people tend to debrief on their own at the water cooler and the staff lounge. And so we're really just trying to capture those lessons learned that are being discussed in a more formal way so that we can problem solve faster.
Great. There are some great answers to your question about how StatDebrief would benefit. Consistency in the data collection from Jamie, on how many events, lessons learned, quality improvement, measures for leadership. And Kristen pointed out that it would ensure that the debriefings happen efficiently without the need to send follow-up emails to ensure the action items are addressed, and can also facilitate data capture and analysis. So again, I think it's really the ease of making these more effective from a workflow perspective. Another, Aaron wrote that it could be a good tool to walk facilitators through the debrief. And then again, that consistent data collection for follow-up. Eugene, pointed out that it can be used to just even get started regularly with doing debriefings. People will then hopefully see the benefit that will allow it to move on from there because of the departmental and institutional changes that can occur. And then Kelly also noted the ability to, instead of the water cooler, people can know where is an appropriate time and space to process and decrease rumors. So I love that, also that benefit as well.
Perfect. Yeah, all great comments. Yeah, I love Eugene's sort of mentality of you just got to get started. Again, you're not going to see big culture change overnight. You're not going to see big outcome change overnight, but it's really sort of that consistency that we need to get started. And unfortunately, I think many debriefing programs start with that burst of energy, but because it's so hard to and tedious to keep the program going, and because they're not seeing early results as fast as they'd like, because of the tediousness of running these programs, then they start to lose steam or they move away, and these programs start to fall apart. And so it's really to try to address some of those issues. So as we sort of reflect on this reflective activity, if people want to put any sort of big takeaway from today's webinar, and then we're going to go into sort of action items and next steps, but could be on really any part, whether the panel, sort of the initial didactics, maybe even just your own reflections and your thoughts about your own environment, about what you need to do. But if you can throw in an aha moment into the chat, and then we'll get into next action items.
Paul, do you want me to read some of them along as they come out?
I think, let's see, just for time's sake, people can maybe just read their own, and we'll, while people are putting that into it, I'm going to go to the next step. And I'm a big calendar guy. If it's not on my calendar, I'm not doing it. So I tend to put great ideas on a calendar either later today or tomorrow. So I really encourage you, here's some steps you can take that might take 5 minutes, would be, visiting some of these sites and checking out what opportunities and tools they have. I think reaching out with an email or a text message to somebody in your own environment who's maybe a local debriefing partner to help you get this going would be really huge. 15-minute commitment might be reading an article. If you Google HHS Wellbeing, the Surgeon General has a great article on well-being that's, again, in line with debriefing, a demo meeting for StatDebrief, or going through that draft implementation checklist. So just some ideas. I encourage you, if whatever type of calendar you use, to add something, if not on this list, something else, just to move yourself one step closer. So I know we're coming to the last few minutes of today's webinar, but it has been great to be with all of you. If there are questions that are coming up, I know Jen's been eyeballing that chat. We're certainly happy to take anything for any topic related to clinical debriefing or otherwise.
And I just added a few more on the well-being, because I think we talked about that earlier, and I meant to put that in the chat, so for reference.
Great. And if there's other topics that you'd like to go in, I know we did a very high-level overview for everybody, but if there is a specific topic within debriefing that you want to expound upon, this is something that we'd love to do more regularly, and we can get future topics going throughout the year.
All right, great. Yeah, thanks everybody for joining us. Yeah, thanks Paul and Jen for sharing your expertise, and look forward to see where all of this leads. Take care, everyone. Hope to hear.
Thank you.
Thank you all.